SATs, like my SAT prep. I remember in high school, like the practice test was like, oh, actually, no, my real SAT, the essay question was like, would you give up your privacy for like increased convenience in tech? And I was like, I wrote yes, and I wrote all the reasons for it, because I was like, I'm not hiding anything, just.
I just want to let you guys know that we're actually live now. So welcome everyone and welcome back to another session of Pre-Dental Universe. I'm Tiffany, one of the pre-dental students monitoring today's session. And we have an exciting presentation today with Dr. Sunyoto. And before we begin, we just want to thank the doctor for sharing your experience and some of your professional insight with us. And on that note, feel free to take it away whenever you're ready.
All right. Thank you, Tiffany. Okay, guys, my name is Dr. Sean Sunyoto. I go by Dr. Sean. Thank you, Pre-Dental Universe. They reached out to me via Instagram to talk a little bit about my experience as a new dentist. I've been out only about 3 years now, almost 3 years. And I want to talk about how general dentistry is a very interesting career. And for those who are pre-dental, that's something you should really consider, being a general dentist first, and then figuring out what you want to do from there. So I'm going to talk about how, what, and why, and how I got to where I am. Even though I'm really early on in my career, I hope I can spread some wisdom, and I'll be happy to answer any questions. Okay, so a little bit about myself. Right here. Oh, I'm going to. Yeah, so basically, I graduated. Let me see if I can full screen. Oh, there you go. I graduated UC Berkeley in 2015, and then I went to UOP right away. It's a 3-year program for those of you who are unfamiliar. And then right away, after graduating, I worked in a private practice starting in Pasadena. Bought into the practice, so I have a little bit of ownership stake there, and then also started a new practice with a couple other people in Buena Park. For those of you who are not familiar with the geography of Southern California, Pasadena is the Rose Bowl, which is North LA, and Buena Park is Knott's Berry Farm, which is Orange County. So, a little bit of a drive between the two, but not too bad. And then, little fun fact, I lived in Singapore for 7 years. When I was a young child, and I enjoyed traveling with my family, even though we had to take a little break because of COVID. I used to do competitive figure skating for much of my life, about 10 to 12 years, and I met my fiance in dental school. So don't lose hope, guys. All right. Okay, just going straight to the point here. I went to Berkeley again. I was a bio major, nothing special. We did get a BA instead of a BS there. For what reason, I don't know. But my GPA was 3.53. I had what you call the typical sophomore slump. That's what they call it. When I finished sophomore year, I decided to take the DAT right away during the summer before my junior year, so that I could apply straight away during my junior year. And if I had to retake the DAT, I would have time after my junior year in that summer. But luckily, I was happy with my score and was able to apply. In terms of extracurriculars, I had a little bit of everything. I did 3 years of like wet lab experience, pipetting, running CPRs. Didn't get to work with mice, but all that good stuff inside the hood. And then I thought special needs aquatics, which means I also used to be like a competitive swimmer when I was a kid. So I used that, and I taught kids how to swim. I did collegiate sports, meaning I did like ice skating with my college team. And also I was a first aid responder at concerts. So that was kind of fun. And in terms of dental specific, I was involved with the pre-dental society in our campus. It may be called pre-dental club at yours. I served as the community service director my senior year. So my other years, I was just a general member and took advantage of all the events that your pre-dental club would host, like community service, socials, things like that. I met a lot of people there who I still keep in touch with. I got my RDA license senior year of high school through a summer program at my junior college, like a community college nearby. And of course, through that, I had many hours of assisting and shadowing experience. That was when I found out I did not want to be like I really hated being an assistant. And suctioning is fine and all, but I remember falling asleep like assisting a root canal, and that was embarrassing. But also, I did not want to be a hygienist because just from there, I just didn't. I felt like I needed more freedom, and I didn't want anyone telling me what to do. So that's where I decided I need to go into dentistry. Or at that time, I was also pre-health, but dentistry is very fun as a career, and I'll explain more. Now it sounds like you look at my profile, and it seems like I did many things. I want to let you guys know that it's not like I did everything all at once. There's a timeline. Every year, I would focus on maybe a different club or a different extracurricular. Um, Dental school wants you to be everything. They want to be all these things that I listed. You want to be talented, compassionate. You need to think on your feet. You need to have some skills. You can tell I'm a very enthusiastic person. I'm very expressive. So all these things have to tie in together to make you as a unique person. Okay, and how do we do that? Is I like to keep it simple. That's what these acronyms stand for. Is basically just find out what you like. I skated for most of my life, and I was saying, that's a very highly specialized skill, and I really loved it. So I found that my college still had some sort of club team. And I did it. It's kind of unconventional to do sports, but I think if you are able to be passionate about it and commit to it, that's the most important, because you need to be able to talk about it when someone interviews you, and it'll show. If you're just making things up, or like you don't really like it, or you're just practicing a couple of answers, it'll definitely show during an interview. All we care about when I was a student interviewer is, if you are a pre-dental student, I'm looking at your at your resume or your transcript. I'll be picking things that are not cookie cutter. Like, I don't really care that you got straight A's and OChem and whatever. I mean, that's great. You already got an interview. I want to pick. It says like, oh, you're like a Quidditch player. Like, okay, tell me more about that. And actually, there's a Quidditch club in my undergrad. So I don't know if any of you played Quidditch, but I thought that was pretty awesome. I never did it though. Okay, so a little bit. Like I said, I did a little bit of everything. Wet lab experience. I did 3 years of it. That's when I knew I did not want to do more research in dental school in terms of wet lab. I did not join any of that. That's me, and this is like community service. All these wonderful people in this picture are in dental school or have finished. So, join your pre-dental club. Everybody's going to be applying together. Everyone will be helping each other out. And remember, there's tons of spots around the country. Everyone should be helping each other. Don't feel too competitive each other. You guys should be helping each other, sharing information, bringing each other up. That's the main goal. Ice skating, concerts, look into that, because if you think about a concert, there's a first aid responder, in sight. So that's what I did. I joined this club or this organization where I was able to like attend these concerts for free, and I saw like who are the people I saw, like Bastille, Sam Smith, Arcade Fire, all these events. I got to go for free. I mean, I was working, but I got to hear music. I got to get my, volunteering experience, and it was a lot of fun. I met a lot of friends through there. It's my buddies here. This guy's in the Army, Korean Army, and this guy's is in medical school. But we all did that, and college is what you make of it. But make it productive. Make it fun. Going through. Oh, this is a video of me ice skating before. So, funny enough, like when all my dental interviews, nobody asked me about anything. Nobody they talked a little bit about oh, how are you an assistant, but you went to college. They wanted to know the timeline because it seemed a little much, but there was an actual timeline for that. But all my interviews, I think I went to 7. Okay, all my interviews, we ended up talking about my ice skating, because all these interviewers, they see hundreds and hundreds of applications. They want to know more. I mean, for themselves. Maybe it's selfish. Maybe they're bored. They want to know more about something they're not used to. But yeah, so since I really love it, I was able to talk about it. All my interviews were very relaxed. I loved all of them, but in the end, I loved UOP the most. Okay, so now we're gonna talk about why I chose UOP. Um, it's a DDS program. Some of you who are pre-dental may look at certain schools. Harvard comes to mind, or Columbia. All you guys in the East Coast, it may be a DMD program. It doesn't matter. I'm sure you already know, but if you don't know, DMD, DDS, same thing. Okay. But the reason I chose UOP, it was in the Bay Area. I loved it. I went to 4 years at Berkeley, which is East Bay Area, but the University of the Pacific, the dental school, is in the heart of downtown San Francisco. Okay, it's a brand new building. Brand new. I think it was built in 2013 or something. So they moved from the old building to this nice new building in downtown. It's the only 3-year accelerated program in the United States. Being that said, because it's 3 years, you have less breaks. I do think the first year is very grueling. 8 a.m. to 9 p.m. You're not. You're not in class per se, but you finish school at 5 or 6 from 8, and then you have to go in the lab to practice your hand skills, like in the lab, and then you still have homework and didactics to study for. So it's a little bit of hazing for the first year. Definitely, maybe it's more stressful, but like I want to stress how important it is to have a good circle around you, because everyone's in the same boat. So my reasoning is, no matter where you go, you're going to adjust to wherever you are. So that 3-year program, I don't think should scare anyone. If anything, it should invite you to do that. A little bit about the program. It's letter grade. You may think, oh, that's not a big deal. College letter grade. I'll just study and get A's and B's. That's fine. But when you want to think about specializing in the future, it's very important, because if you go to a very hard program that's 3 years like UOP and it's letter grade, you have a distinct class rank and GPA to report to the specialty program. So you may have a lower GPA, which may put you in a disadvantage compared to someone who went to a pass no pass school, where let's say they didn't even pass with honors, but there's no GPA to list, so it could look a little better that way, and maybe it's less stressful to go to a pass no pass program. I wouldn't know. But the advantage of the 3 years is you get out 1 year early. And, the 1 year that you get out early, you're out in the real world. Let's say you totally hate it and you're like, I hate cleaning teeth. I hate doing fillings. I hate crowns. I hate extractions. You hate everything except root canals. Then you're like, oh, okay, well, now in the 4 years and when you're working, I realized that I want to go to an endodontics program. So, that's another thing. And I put down here more prime years. That means a prime year means that this is the year right before you retire. So let's say you're 64 and you're going to retire at 65. You have that one extra year where, let's say you're earning, I'll just put a number out at 300,000 a year. And you have one extra year that you're working before you retire, and you have more potential to earn more money because you're 1 year ahead. That's the argument of the school. Okay, so that was one of the arguments they said. Specialties for myself, I always knew I wanted to be a general dentist, because I just didn't think I would want to just do one thing. So I already knew. But UOP as a school is very good for general dentistry because they have a very heavy emphasis on their clinical program. So like not so much didactics, but they pride themselves on producing a lot of good general dentists. And then in terms of extracurriculars, there are a lot on campus. But like I said, with the 3-year program, it's very tough to branch out, in my opinion. But internships and extra hours are available because UOP has a endo program. They have a ortho program. They also have an oral surgery program they work together for an adjunct hospital. And then they also have an advanced general dentistry program, which is like a 1-year residency that some general dentists do graduating. And that's where you have extra experience working on patients and advanced cases but you still have faculty that can look over you and make sure you're doing it right. And you're required to do like lit review, a literature review, present your cases, and you're already a doctor at that point. But they also have that program available. So being a graduate of UOP opens up a lot of doors. You have a lot of connections and people that you know about. But I do think every dental school has their own network, so you can't go wrong anywhere else. A little bit of advice is first get into any dental school, and as long as you have more than one choice, that's where you can start picking. Number two is pick the cheapest school because it doesn't really matter. None of my patients, I bet you more than 50% of my patients don't know where I went. And then number three, then start looking at what school you felt like you vibed with the most. So interviews are important. Don't be afraid to fly out there, and take one more look. I was very lucky to stay in California. I don't think, like for example, I got into Buffalo. I don't think I would have been happy. I just don't think I could handle the cold. Besides being an ice skater, I just don't want to live in the cold. So that's something, it could be something because if you're, going home at 9 p.m. every night, you might want to be comfortable. All right. Going here. Okay. So now we're going more about, I graduated and now I'm in dentistry, general dentistry. I want to emphasize that we're the quarterback of dentistry, meaning you can choose to run the ball, you can choose to throw the ball, things like that, where you can, and we can do so many things, gum grafting, oral surgery, composites, which is just fillings, things like that, cosmetic dentistry, root canals. The pie is so large. And as a general dentistry, you get to bite a little bit of the pie, but maybe we can only get the crust. So you have to know if you want to specialize, you get to go deep in the pie, but as a general dentist, you're right around the crust. Okay, so you get to do a little bit of everything, which is fine, which is what I'm happy with, and I'll go through some of my cases. Yes, and I just want to emphasize, as a young dentist, I do think anything below 10 years, you're still a young dentist. There's so much I learn every day. The reason I say 10 years is because let's say you do some work on someone in your first year, you're going to be seeing that work over 10 years. And unfortunately, you learn that way too. Sometimes you do things a different way or you do things a certain way, and then they come back and it doesn't work. And that's how you gain experience also, because not everything in school, there's not enough time for you to learn everything. And even if you take classes outside, once you're a dentist, dentistry is so, it's a skill, it's very specific. So whatever works in my hands may not work in your hands. Whatever works for this world famous lecturer, that you paid thousands of dollars for, may not work in your practice. So you have to try it out. You have to see if it fits your practice flow, things like that. So when I graduated, and my head was, I don't know, this big or something, I was like, oh shoot, I took out like 60, 70 teeth in oral surgery rotation. I'm so good at taking out teeth. And so I was right here. And then those first 6 months of working, brutal. I would go and work every day. I see like a really tough extraction on the x-ray and I would start getting nervous. Like, I would start, thinking like, what if I can't get it out? Which has happened a couple of times when I first started. But luckily I had a very good mentor. So when you start seeking out those mentors while you're in dental school, and then when you land a job, it's very important, in my opinion, to have someone that can bail you out, or like a senior dentist there, because that's how I learned. So yes, quickly I realized I didn't know anything, and it just dropped back down here. And dental school is really just there so that you know the terminology, the basic science, the basic dental science, and then from there, after you graduate, that's where you want to take your skills up a notch. You got to work on your skills. So, I'm still, I'm right around here. I'm still hovering between assimilating information and applying them. And I'll try my best to share what I've done so far with you guys, and hopefully it gets you guys excited. Typical day for me, I want to go over is, I see 10 to 15 patients a day. I've been doing 6 days a week since graduation in 2018. I do think working 6 days a week has afforded me, more experience, compared to someone who only does 4 or 5, rightfully so. I see more patients. And working 6 days a week is also very uh, beneficial in the beginning as a young dentist. It's 4 days a month over a year. That's a lot of extra income that could be used to aggressively pay off loans, things like that, or save up for a house, car, whatever you want. So I think working a day here and there on Saturdays is a good option. So I welcome you guys to expand your minds, and if you want to work 1 or 2 days a week, a month extra, that's fine. But it's good to have a balance. So yeah, I see 10 to 15 patients a day. A mix of fee for service, that's FFS, which means patients with no insurance and they pay cash. Okay, PPO, which is private insurance, and Medi-Cal, which is the state Medicaid program. I do not see any HMO patients. I know some people do. I don't know much about it. It's just how I found myself within this group that I work for. I do my own cleanings. Some people don't. They have their own hygienists. I do cleanings. I do fillings, crowns, root canals. I also do surgery, like wisdom teeth extractions, broken teeth, some kids, implants, and I've done quite a bit of Invisalign recently. Okay. So as a general dentist, you get to do all these things. So I never feel bored at work. I remember when I first started working, when I turned 16, I was a kind of a lifeguard for that skating rink. It's called a skate guard. And, you get bored at work. I'm sure you guys, you're working before you get bored. But as a dentist, I never get bored. Like, never. So I don't know if I just love dentistry and that's it. But I've had a great 3 years working so far. It's been very fulfilling. I'm very excited for you guys, and I'm very excited that we're able to, even give these presentations over Zoom. So again, I'm gonna, remind you guys, don't hesitate to DM me on Instagram if you have any questions. Okay. So how do we get here? You don't go out of dental school being able to do root canals, wisdom teeth, implants. They don't teach you that. I mean, by the time you guys get into dental school, maybe there will be some implant placement in the curriculum. I have seen some dental students place 1 or 2, which is amazing, and I think that's with the amount that you're paying, I think that's a necessity. But the progression is, when it came out, I did mostly a lot of exams, fillings and cleanings and crowns. Okay, and I still remember like my first couple crowns in private practice. I was still kind of like shaky, very slow. But the most important as a new dentist is being able to do an accurate exam. You don't want to miss any cavities. You don't want to miss just things, pathology, and I miss my few share of things, and I still miss things sometimes. If you're not careful, you may miss little things here and there. But having a good exam is key. And then I was allowed to do root canals in the front. That's what interiors mean, and premolars, which is right behind the canines, in the beginning, in my group. And then once I did, a good number of those, that's where they progressed me towards the back, the molar root canals. When times were slow, I would take out, I had a whole jar of teeth from all the teeth I extracted. I would just sit there in the corner, and my boss would make me drill into the molar root canal so I could see the chamber inside, so that you start building that visual and muscle memory of how it feels to drop in the chamber, look at the number of nerves and things like that. Wisdom teeth, I'll talk more, but basically I was also, I think I only took out one set of wisdom teeth in dental school on one patient, and that was it. And it's a whole different ballgame than extractions in the front. And after I mastered all those, that's when my mentor and boss was like, "Okay, I think it's time to place your first implant." And he brought in a family friend, and I was able to place an implant, learn how to do that, and then took classes. And now I've placed over 100 implants so far, maybe even more than that. So that's what I'm doing every day, almost every day now. And Invisalign, which I had the opportunity to learn how to do that in University of the Pacific. My dental school has a strong Invisalign program, so I was able to get exposed there. And Invisalign is a $1 billion maybe $1 billion company. So they have a lot of money once you graduate. When you join as an Invisalign doctor, there's a lot of free training they send you out to, a lot of webinars, a lot of online information. So Invisalign is an amazing product, and in the right hands, it can do amazing things. Okay, a few cases. So it was good that I was reached out over at Instagram. I created this presentation for a different group, but I created my Instagram, and I encourage you guys to do so, even though, like, let's say you're only pre-dental. I mean, everyone has a different way to get motivated. I felt that when I created my Instagram, I created a lot of accountability for me to document my cases and track my improvement over time. So this is in the very beginning stages. This is like one of my first few posts. This is just a simple, and not simple, but these are just fillings. Like you can see here how dentistry. Just by looking at this, if people ask, "Oh, why do I need X-rays?" Because like, look at this too. Doesn't seem like there's a cavity. It doesn't seem like there's a cavity. This is a sealant, by the way. But then when you open it up, this chalky white stuff, that's a cavity underneath. That's why you need X-rays. So we did the cavity. We filled it. Filled this, and this is a rubber dam. I ordered it in black just because like I think it looks cool. It makes me happy. So just these little things like, these fillings look good before and after, but little things in dentistry that people pick on are kind of like this filling. It should be, maybe this corner should be a little bit rounded. Stuff like that. Don't kill yourself over it, but those are the little things that make my job interesting, because every day I can do a filling, but I can try a different technique, or I can refine my technique and try different things, and makes it a lot of fun. And things like this, this is someone's old filling. This is actually a cavity right here, guys. And this white area, that's the gum. So the cavity is below the gum. Okay, so by the time I removed all this cavity, it was way deep, and I was able to isolate it and fill the cavity that deep. And it's the little victories throughout the day that really make you satisfied. And there's tons of people sharing like techniques on how to do this, which I think I actually learned over Instagram, how to isolate this area and pack it in and fill it. So it was one of my few victories when I first started out. A little bit about cosmetic dentistry that I've touched on. I know it's a hot topic. I feel like when I was in college, a lot of my pre-dental friends wanted to go into dentistry because of cosmetics. They wanted to do veneers, crown, make smile makeovers. You see dentists in popular media doing that, like the doctors. I haven't had the opportunity to work too much cosmetic dentistry. I think it really depends on what practice you land in and where you want to take yourself. But I'm more of a functional, everyday general dentistry type of guy. I do some implants. I love surgery, but I'm trying to get better in cosmetic dentistry. So this is my case right here. Patient calls saying that his veneer cracked. These veneers are actually, I think, 10 years old. Okay, I didn't do them. This is a crown. This is a crown. He's had that replaced, but this veneer, and this veneer, which is on number 9. If you guys know the numbering, number 9, number 10, cracked. And in reality, 10 years of service is pretty good. And he doesn't wear a night guard. Doesn't do anything, but take a look at the bottom teeth. Super flat. See all these patterns? Super flat. So these are called destructive patterns, because if you ask him to bite down, slide his teeth around, you'll see it sliding on those veneers, and no wonder it broke. But unfortunately, I practice in a type of practice where I'll tell the patient, hey, you need Invisalign or orthodontics to like push down this teeth and straighten them so they don't wear down your veneers or wear down your teeth even more. But my patients don't, they're not you don't have $1 million. They're not going to say yes right away. So it's important for me to fix the main problem first. And as a general dentist, you have the opportunity to build many, many relationships with your patients over the years. So we call it planting the seed. So let's say I tell, let's say Mr. Smith here that, he needs Invisalign. today and a veneer. He's like, okay, I'll say yes to the veneer, but the Invisalign, I'll think about it. He'll be back in 6 months for another cleaning. I'll say the same thing. And, you don't want to be pushy, but you just remind him that this is happening. You take pictures. Over years, you're going to see more and more shaved down. And I have no doubt, eventually they will pull the trigger. They're going to do the treatment and whatever else he needs, okay? But I'm going to a little bit go through here what happened. This is the shot of him biting down, and you can imagine from him biting down to pushing out his lower jaw, that's how the veneer cracked. And there are really fine intricacies to dentistry that when you want to match the color of a tooth, it's very important that you take the color in the beginning. Because what happens when you work on the tooth over time is the tooth dries out. The surrounding teeth will dry out. And losing that water content in the tooth actually changes the color. And also, you're working under, either the light, the overhead light, or light from your loops. And depending on what, those photographers out there, if you know, like what Kelvin, the lighting is, it will look different. Okay, so it's important to take these pictures and have a consistent lighting source that you can send to the lab so they know that what the actual color is. So here I'm taking the color of this tooth, and I'm also taking the color of the inside tooth so that the lab knows when they build something, you don't want this color to come out. They want to build some sort of what they call like opaque or a masking color at the back so it doesn't show through. So this is important things to communicate with the lab, including the color, what the color is. This is 5M3, this is 1M1. And actually, this is here right after he left the office that day. This is a temporary I made for him. He was very happy already. I'm pretty happy here too. So cosmetic dentistry is gratifying, but you have to control so many nuances. And also, some of the patients that come to you for a full set of veneers or redoing a set of veneers, there's a whole psychological aspect to it. Their teeth may look perfect to you, but to them it doesn't. So, when you're a dentist, you're a quarterback. You're also, I feel like every day is a show or a movie. Like you're directing, and if you go in there with bad attitude, you go in there with, negative attitude, your patient's gonna feel that. But if you go in there with positive attitude, you think, you tell the patient their teeth are wonderful, or you're gonna change their life. They're gonna believe you. And of course, you have to do good work, but a lot of it is mental also. Okay, so a little bit about wisdom teeth extractions and why, as a general dentist, I do think it's very fun and something that can, not make your day boring and things to, just little things that why general dentistry is good for this. So, as a general dentist, if I look at a wisdom tooth, someone comes in and it looks like, let's say he's like 50 years old and the wisdom tooth's hurting him and it's lying down. I don't have to do that. I can refer it to my oral surgeon. Let them handle 50-year-old dense bone. Bone's really dense, and it gets it's very hard to take out. It could be a lot of complications, and as a general dentist, that's where I find a lot of joy. Where I get to do whatever I feel comfortable with, and anything I'm not, or I think that the patient's more suited for, I'll work with my team of specialists, and they can help me out. But in terms of wisdom teeth extractions, like I say, pick my battles. When I first started out, I took out wisdom teeth on 16 to 20-year-olds. That their teeth were fully upright. The roots were not fully formed. So as soon as you stuck the instrument in there, they would pop right out. That's how I started out. And then once you have, more confidence, that's where I started going towards more fully formed wisdom teeth. Some wisdom teeth that were to the side, wisdom teeth that were to this side, like distally angulated. And the fun thing about wisdom teeth, everything is a puzzle. The tooth doesn't want to come out because it's too big for the socket. Okay, that's the main thing. So when you want to get the tooth out, you have to cut it in pieces, and you have to think about which way is the best way so that the tooth would come out gently. Okay, as you want to be aggressive in terms of cutting the tooth, but when it comes to using your hand and turning the instrument, you want to be gentle because the patient will feel it in the joints. They'll feel you like cranking it, and they're gonna think you're doing something wrong. So something like this, I drew the arrows. Number one, I would cut right here, and I would put my instrument back here, and I'll just push it towards the arrow, and it will come right out. Same thing after I cut the second one, I stick my instrument in here, and I'll push it towards the back. If I push it towards the front, this tooth is actually curved this way. So if I push it towards the front, this root right here, which is actually this root, so look how curved it is, would actually catch the bone, and it wouldn't come out. You're just cranking in there, and what's going to happen? The root's going to break off right here, and that's what you don't want. And ask me how I know how. That's just all from experience, and now I know what to look out for. And I'm still surprised every day, and I still have difficulties sometimes, but that's how you learn. Go here. Okay, and another thing that I've been very fortunate to been able to experience, and I feel like once most of you are in dental school, you will have more and more of this opportunity is CBCT, which is, what is CBCT? It's cone beam technology where they take a 3D scan of someone's jaw. You get to see the tooth from all angles. You get to see the bone. This is very important in terms of wisdom teeth surgeries, bone grafting procedures, extractions, seeing how root canals heal, how many canals the teeth have. Because on a usual X-ray, you're only seeing a 2D image. Okay, so for example, on this patient that I had, on the normal X-ray, which is the 2D image, you could only see an infection on number 2, which is the terminal tooth on the upper right. But when you look in her mouth, there was a pimple on 2, but the whole gum was swollen up to 3. And when you pushed it, like pus was coming out. So I was like, okay, you know what? Let's take a 3D image. And sure enough, man, that was a huge infection. And you can see this is an axial view, which means from above, you can see that the terminal tooth, there's no bone on the root right there. And even towards number 3, there's no bone. And even on the cheek side, this is called the buccal, the cheek side, the bone has been obliterated, meaning the infection has ate away at the bone. So all I have to do is pop this up on my big screen. I have a monitor that's another thing. A monitor that I got on sale, you would think is expensive, but it was only like $180 for like a 50-inch TV. I pull it up and show the patient, hey, you need to get this out, because originally she only wanted to get one out, which is the last tooth, the number 2, because it was moving. But then I showed her the picture, hey, like, this is 2 teeth, like, look at this, how much infection's in there. We have a lot of new research that shows tooth infections are, you find people who have heart attacks, they find the same bacteria in the heart from the bacteria in the mouth. I mean, we don't know if there's really a direct link, but little things like this makes us wonder, is it really good to keep an infection in the jaw? Probably not. So this 3D technology has given me more to see, and I'm able to diagnose more and keep things simple, and also make sure that my patients achieve a very high standard of care. Okay, to keep on going, the reason, this is the same patient. Okay, so I get better outcomes from 3D technology because I can check the quality of my work also. So I took out both of those teeth. You might remember it's on the upper 2 teeth. I waited for about 2 or 3 weeks for her to take some antibiotics for the infection to kind of go away. And when the body heals, the socket will have a lot of granulation tissue and tissue that started healing, and all the infected material will start actually bunching up. And it almost is like a booger-like consistency, but once you get in there after 2 or 3 weeks, you can scoop it out really clean, and you can feel the bone all around. This is the socket, and I actually packed in more bone, like artificial bone in there, so that 6 months from now, this will heal nicely. But I took an image right after, because on a 2D image, you'll just see the bone on the side, it'll look nice and dense, and you're like, okay, I'm done. But when you take a 3D image, you can see, did I really pack the bone correctly? And you can see from the top, it's very densely filled, maybe a little less dense towards the tongue side or the root side of the mouth, but as long as it's mostly covered, that's good, But for me, I like to improve, so I know that next time, if I ever have a similar case, I will be packing in the socket a little bit more, taking more of my time, things like that, because I want to do my best so that the patient's body can take over the rest. Okay. Another image about cone beam technology and being a general dentist. When you're good at surgery, or like you're very comfortable with surgery, you get more comfortable with many other things. So for me, the more comfortable I got with surgery, the more comfortable I got with implants, the more comfortable I got with extractions, the more comfortable I got treating anybody. Because, if I can take out of all the teeth on someone's upper tooth, upper and jaw, and the patient is fine, after a week, they're like, oh, doctor, I didn't have any pain. I'm not going to be worried about if I do a simple filling or a crown, and I'm not going to lose sleep over that. Like the more bigger procedures that you do, the less worried you are about the smaller things. So that's why I encourage everyone to try everything and gain experience in everything. Because once you see a full mouth extraction case, people, we're in there. We're taking out this big giant drill, and we're smoothing out all the bone. You see all this blood splurting everywhere. Nothing's gonna scare you. So it's good to shock yourself. Good to see the world, and from there you're able to treat your patients more confidently. So for this guy, we'll call him Bob again. He had no teeth on the top. Before I saw him, he had no implants. He couldn't wear a denture because he has a big gag reflex. So I made him a denture, but then he couldn't wear it. So now we're like, okay, what can we do? And he's on Medicaid insurance, so his finances are limited. So there's a way that we can do called a U-shaped denture, where instead of a full denture up for the upper, you can cut it so that it looks like a horseshoe puck, and you attach it to implants. And so I placed 2 here on the upper right, and I wanted to place 2 here on the upper left, but I want you to take a look at this image. You'll see this line right here and another line right here. That means this is the sinus, meaning this whole area and this whole area, there's no bone at all. So when I was there during the surgery, this area, like even though there looks like there's bone here, it wasn't thick enough horizontally. So I had to go in there. I looked at, you can measure from a cross-sectional view. I only had 4.5 millimeters in that spot. There was just not enough to place another implant. So we have to go back in there. I had to put more bone on the side of the implant. I actually drew his blood. Okay, there's crazy things in dentistry. Why would I be drawing blood, right? No, I drew his blood. I spun it down in a centrifuge, and you can mix whatever that you spun down, like the fibrin becomes like this membrane, and you can mix some of the growth factors that you centrifuge down with the bone, and it becomes like a gum-like consistency, so it can really stick on there. And I came back in 6 months, and you can see the bone grew just a little bit, just enough. I want to go back. Right here, you can barely see it, very thin. And it grew about, 1 millimeter, 1.5 millimeters right there, a lot thicker, so I could place an implant in there. So kind of exciting. Like that's why I like surgery. You put some bone in there, and it's kind of like I'm tending to my plants. I come back in 6 months, and I'm like, oh, look, it grew, and I get really excited. And now I know. Okay, so when you want to place an implant, you want to place it right in the center. Okay, you don't want it out this side, you don't want it out to this side, because you need bone all around the implant so that it has a chance to last the patient many years. Because no matter what, some bone loss may occur over time. So you want to make sure your implant's more encased in bone, just in case that happens. This is post-placement, so I was able to place the implant directly in the center. I'm in the process of converting these implants so they can attach to the denture. By the time you guys are in dental school, it'll be more prevalent. when I was in dental school, we didn't place implants. We learned about it a little bit. But I hope by the time you're in dental school, you get to place implants. And then you also get to learn about what they call guided surgery. So what does that mean? Basically, from a cone beam image, they come out and they can export the file. The file format is an STL file. It's an open source file. They can format that, and then they take a intraoral scanner. I don't know if you guys ever seen that, like a 3D intraoral scanner for 3D models. A lot of orthodontists do that. So they take that scan and they merge them. So they have a model of your teeth and they have the 3D model and they merge it, and then you can plan where you want their implants are at, and then they can print out like a template. So you can stick it on the patient's gum or their teeth, and there'll be little holes that your drill just fits in, and your implant preparation side is perfectly where you want it, and you can plan it digitally. So it may take longer to plan it, let's say an hour, or if you outsource it 30 minutes, but your surgery will be like 5 to 10 minutes because all you're doing is slamming your drills into these little holes that are already pre-cut. And I think that's the future. So for all you pre-dentals out there, get really comfortable, with digital, just being good with computers and 3D printing and things like that, because I foresee that happening in the next 20 years. Everyone's going to be 3D printing their own surgical guides. Everyone's going to be 3D printing their own night guards. And if you know how to do that on your own, you don't have to pay the lab. I'm trying to do that on my own, but once you start working, it's a lot of work, but I'm trying. And hopefully, if I ever do another presentation, I have more material on that. But like a little bloody picture, but this is the same guy. This is what we're doing right now. We're in the process. So on the upper right, there's 3 implants. This is the gold things. They're called locators. And then the 4th implant I place is a bit behind there. It's not ready yet because I had to wait for the bone to mature. So I placed the implant later. But these little things will hook on to the new denture. So they hook onto the new denture, and I get to cut the denture into a U shape, so it's not in the palate area, and then the guy won't choke, and he'll be able to smile, eat, and he'll have the benefit of implant retained dentures. They didn't want to flop around. So I'm very excited for him. I think I'll be done with his case in another month. So this is how dentistry, you can change someone's life. And as a general dentist, I can place implants. I can do the denture for him. I can, you take out his tooth. I place a new implant for him down here. You don't have to be a surgeon. You don't have to be a prosthodontist to do dentures. Just get good at doing them. Take the cases that you can. Refer to the ones that you can, and you want to make sure you're doing everything in the best interest of the patient. So if I knew I couldn't do this for sure, I wouldn't be doing it. But this is what I've done so far, and you can change people's lives. Oh, that's another one. So when you get good at surgery, you can and get good at dentures, you can change someone's life. So like I say, immediate dentures, meaning this is the classic tooth in a day. This guy, he's 20, I think he's like 24, 25. Nice guy, really nice. You can see this is his before picture. He's lost teeth here. Actually, he didn't go to the dentist to take it out. They just fell out on their own. You'll have people coming to you saying, "Oh, my tooth just fell out," and you're like, "How?" Okay, but people with underlying illnesses, like this guy has uncontrolled diabetes, things like that. When you have uncontrolled diabetes, it can lead to uncontrolled, gum infections, periodontal disease, if you guys are familiar with that. So all of his teeth were moving like crazy, and I'm sad to say, from 2 doors down, you could smell his breath. Okay, it was bad. He came to me, wanted a solution. Also, another guy on Medicaid. So what we did was we actually took out all his teeth and delivered the denture same day. And you can see this is the guy right away. This is the same day. And I cleaned up the blood around him, but nice guy. You can change someone's life because now you can chew. Before he couldn't chew anything because his teeth would, if he bit too hard, and they would fall out. That was so sad, but it's something you can do as a general dentist. Implants, as the better you get surgically, you're taking out wisdom teeth, you're taking out all these teeth, then maybe you're thinking, oh, maybe it's time to start placing implants. And there's so many things in dentistry to learn. Like I say, keep your mind open, but also understand that dental school is just vocabulary. Okay, you're just gonna learn the pure basics. And even when I placed my first implant, my instructor and boss was telling me, okay, just make sure the implant is below, the bone, the crest of the bone. You want to make it straight. You want to, make sure those are good. And then he looked at it and he was like, oh, look, that was perfect. But now after placing 100 or so, there are so many things that I didn't know about implant dentistry that I know now. Things like you can even tell like this implant on the right, which was like a more recently I placed at a slight tilt because you don't want to place it too straight because later on when the crown comes, if it's too straight, you'll have a bigger crown. So if you imagine the implant is placed this way and then you have a crown, it's going to be angled bigger and you have like a mushroom. Versus if you angle the implant closer to the tooth, you have a more anatomical crown that's going to be on here, and it's easier to keep clean for the patient, and it'll lead to a better implant. So there's like a million things that could go in there, and that's what makes dentistry so exciting because I feel like I have a vast ocean to still traverse. I'm an academic. I love studying. I kind of miss school sometimes, but I don't miss the stress of it. But that's why I want to tell you guys that dentistry is such a great career because I could talk all day about this single image with someone. I'm not going to bore you guys, and it's too technical. But even photography, even like I got a nice picture of this implant, I got excited about it. So there's a lot of things to photograph too. A little bit about advancing in implants. So you don't have to do single implants forever, and I took over a practice where he didn't place any implants, so there's a lot of bridges. So after 50 or so implants, I started doing more multiple implants, and this person had a failing bridge. You can see this is bone loss, this is infection, bone loss here. This bridge was moving. So what did I do? I cut off the old bridge, and the same day I placed 2 implants. And now this lady has, 2 new teeth that, they'll never get her another cavity. I mean, she still has to clean underneath this crown because I splinted it together. And yeah, so that was fun. And this lady on the right side, she walked in, and I got a good chance to combine my bone grafting and surgical experience with my implants. She walked in very thin bone. That's what happens when you don't have teeth for a long time. When a bone is not in function or under load, as they call it, your bone will start resorbing or basically dissolving and getting thinner and thinner. You're gonna sometimes you flap open the gums and the bone's like not even bleeding. It's just dead. So what I had to do there was I wish I had more pictures, but as a young dentist and I have so many things to worry about when I'm doing a case. I sometimes just don't have mental space to take the picture. You flap open the gums. You make a bunch of tiny perforations into the gum, into the bone right here to cause it to bleed. And I made a little slit on the top of the bone. And I prepared 3 sites for the implants and actually cranked the jawbone out a little bit to expand it. And then I placed the implants in there, and then I packed bone and all the crevices that opened up. Okay, and then I entered it 6 months later, and you can see how we only had 5.5 millimeters of bone at that site. And after placing it 6 months later, I had 7.5 millimeters of bone. So that's 2 millimeters of increase. That's like 20, 30% increase. And now she has 3 implants. I should have updated this that I delivered to her about a month ago. So very gratifying case, combining implants, another procedure called ridge splitting, and bone grafting. Like I said, combining treatment modalities. This is another big case that I did. You can remember the guy that had diabetes, and I removed his teeth, put the implants in. I put the denture in. That's step 1. This is another patient. This lady came to me. Her 2 front teeth had broken off 3 times before. These teeth were on the verge of breaking down. There's cavity here, cavity here. This tooth has broken off. And she said, Dr. Sean, I'm here because I've been to 3 other dentists. I want to take out all my teeth, but they want to save it. But I told them I don't want to do it anymore. And I wanted to take out my teeth and do dentures. And I was like, okay, well, let me take a look. And I agreed that these teeth didn't have much life to them, especially there's decay near the gum line for most of them. I said, if you want to do dentures, I think you should do implants because you're not going to be happy with just dentures. And she was like, oh, okay. So that's what I did. So I took out the teeth. I delivered the denture the same day. But the same day, I also placed 4 implants. So I placed the 4 implants, and all these sites where the tooth was taken out, I grafted it with bone, which I also mixed with her blood that I drew out and spun in my centrifuge. So I combined these many treatment modalities that I got experience from, early on my first or second year, and you start combining things as you get more and more experience, and then you get to do all these cool cases. The next step for me is 6 months later, I'll be able to put those locators, that little gold attachment that you saw in the other picture, and make her a new denture that snaps on, and I can also do a U-shaped denture. For those of you who are really, really into dentistry and are already in dental Instagram and following all these cool people, there's people that take out these teeth, they smooth out the bone, they place the implant, and then they immediately load the implant, meaning they have a fixed denture already that they screw the implants onto. So the patient literally has teeth in a day that they don't take out. So it's amazing that they can do that. That's a little bit beyond me. I like to say one miracle at a time, and this is a miracle for me already. So maybe one day I'll get there. Lastly, something that I've been doing a lot more of is Invisalign. The reason I say it's stress-free is, you're not going to go around talking to people, oh, I got an implant, and you're going to showing people like, oh, I had a wonderful implant experience. They didn't have to cut me at all. They didn't have to numb me. Nobody's going to talk about that. But when you do Invisalign, I scan the people with my scanner. I give them their trays. I make some adjustments. I put on the little buttons that are tooth colored, and then I see them time to time, and then magically their teeth move. I tell them it's just like magic. Just follow my instructions. Patients love to talk about it, and I've had a lot of gratifying experiences. So I can understand people who want to be an orthodontist. I remember getting my braces removed and was so happy. So you get to do that too as a general dentist. I want to emphasize that everyone here should be constantly trying to improve. Don't even underestimate anything. Like, I don't underestimate a simple filling. I don't underestimate anything. So that when I get better in root canals, implants, getting better at fillings, they all play a little part in your improvement. General dentistry is a huge field. There's so many ways you can take it. I love it. But most importantly, I love my patients. Okay, so my main goal is to have a very good relationship with all my patients. Make sure I go in there. I don't rush straight to their treatment. I go in there. I say, hey, hey Tiffany, how are you today? I talk a little bit about them, and remember little things about them. How's your son? Things like that. Then we start about the treatment. So, they're people too. I treat the patient. I don't treat the X-ray. I don't treat their tooth. I treat the patient. So I focus on patient-centered care. So far seems to be working. Reviews aren't everything, but they are nice in today's era to bring people in. So learn to listen and be a caring individual. Okay, and thank you. I know this is it's already time flew, but find me on Instagram. Feel free to email me. I can help you guys out as much as I can. I know it's a big scary world out there, very uncertainty. You're going to get into dental school, you don't know you want to do it, things like that. So just feel free to message me anytime, and thank you for having me here.
Thank you so much, Dr. Sunyoto, for your time and your insightful presentation. I'm sure everybody learned a lot from hearing about your experiences and your cases. So now we're going to ask a few questions from the live chat. Is that okay?
Perfect. Anytime.
Okay. So the first question that we have is, did you do a GPR or consider it? If not, why did you decide not to do it?
Okay, that's a great question. I think everyone should consider a residency if they want to be a general dentist. But the big factor for me was I had a job lined out as soon as I graduated with a very, very willing mentor who was willing to walk me through things. and willing to, shoulder that burden, because having a new grad who doesn't know how to do anything is a big financial burden and also stressful in terms of, you're letting them treat your patients, and now I get that. So if I didn't have that, I would have strongly considered a residency, but also it depends on what kind of residency you get into, because I had an instructor tell me that her residency, which was in New York, she did simple fillings and cleanings and all that every day. There wasn't anything like advanced that she learned. The only saving grace was that she got to live in New York for a year, which maybe that's something, one of you, that's a lifelong goal for you, then go for it. But if it's not a program that gets you well versed in surgery or root canals or implants, things of that above, or advanced cosmetics, I wouldn't consider that.
Thank you, Dr. Sunyoto. Our next question is, how can one work on their dexterity skills before dental school?
Unless you're notoriously bad, like you just think you're horrible at something, I wouldn't sweat it. I played a lot of video games growing up, and I was in a performance art sport, so like I'm very artistically inclined, but I wasn't a natural. I think just being in dental school and practicing in the lab will be enough. If it's not and you're just horrible, there's remedial. So like you'll fail your class, but then they will help you out, which is fine. And you're still really bad, and you still love dentistry. There's many things in dentistry you could do, like oral pathology, dental anesthesiologist. So they're not really hands based. So there are fields like that, but I don't think if you're a pre-dental, I don't think you need to be so much focused on the dexterity portion. Yeah.
Thank you. So the next question we have is, how did you determine which dental schools had pass or fail or had letter grades for their courses?
Okay, perfect question. I'm not sure if any of you still go on Student Doctor Network. It's a toxic site, so feel free to browse it at your own peril. But when I was applying, there was like an Excel sheet with all the schools and like what kind of letter grade system there is, and sometimes it's on the website. And also when you're at the student interview, when they ask you you have any other questions, Sean? And then you're like, no, I don't. Oh, no, don't do that. Have a list of questions to ask. That's a perfect question you can ask them. Like, are you letter grade? Are you pass, no pass? What do you think of your pass, no pass system? What do you think of your letter grade system? What are your honest thoughts on this school in terms of specialization? Make it clear to them that you're not there just like, oh, I want to do oral surgery, but make it clear to them that you're open to ideas, and that's how you find out.
Our next question is, why did you decide to go the general dentistry route over specializing, since it seems like you're very interested in surgery?
So I didn't actually. Yes, that's true. I'm very interested in surgery. I didn't include that, but when I was a senior in college, I always wanted to possibly go into an oral OMFS program, like an oral surgery program. I'm a very letters kind of guy, meaning like I thought it would be cool to get my medical degree and a DDS degree, but in reality, that's a lot of school. My brain and emotional state can only handle so much, and I think there was a reality check when I got into dental school how hard it was, and I found myself liking general dentistry a lot more because I was able to shadow my current mentor and boss, and I thought that was a good way that I could get out of school, start owning my own business, have a life outside of dentistry. And as a general dentist, you can earn multiple office. If you want to go that route, there's a whole business aspect that I didn't talk about, where you can own multiple offices. You can have your own associate. So let's say you want to work only 3 days a week, you could, and then you just have an associate those other days. So I felt like as an oral surgeon or specialist, I'm sure you can go that route too, but it's a lot of school years invested. to your career, even more so than a general dentist. So I felt like you would probably feel indebted to practice more. You know, I see. Yeah.
Thank you. Okay, so the next question is, how did you study during dental school, and do you have any advice or study tactics?
You know, if you already got into dental school, and I assume if you got into dental school, you're a very, you know, don't count yourself short, guys. Like everyone here is a very high achieving individual. You know, take solace in that and find confidence in that to be able to apply yourself in dental school. You know, don't get caught up with what Sally or, you know, whatever Bob's doing. Just focus on what has worked for you in the past. My recommendation is to have very good time management skills. So when, you know, crunch time really happened, I would have a Google Calendar. I think you would have a heart attack if you looked at it, because like every single part of my day was scheduled, including sleep. I mean, that didn't work for a very long time, but maybe like during final season, I would do that. And also like, don't kill yourself. Like if you feel like, you know, you don't want to specialize, but you want to do good in your studies, you know, I wouldn't have killed myself to get 100 or like a straight A's, you know, something like that. As long as I got the concept and I felt like I studied enough, I would take a break. I had a lot of hobbies in dental school. Like I picked up marathon running because I just needed to get out, not use my phone, and I, you know, would run like hours a week, many hours a week while I was in school. So studying isn't everything. You need to do things outside of studying, and then when you study, you'll actually be more productive. Don't study with your phone out. If you study in a group, make sure everyone in the group is on the same page, because you don't want someone who hasn't studied at all. Honestly, they might drag you down, right? So, but if you're all friends, make sure everyone's accounted for. You're like, hey guys, if you're gonna study together, you know, make sure you're already caught up on the material. So, all of you are college students. You know, you should be figuring that out now. If you're still early on, you will figure out soon enough. You know, if you don't do well in your classes. But by the time you're in dental school, just focus on doing what you can. When you're working on lab skills, have a hard cutoff. You know, if you're there from 7 p.m., you know, if it's 9 p.m. and you're still not done with the prep, or the preps are the things you drill on, you're still not done, or it's not perfect, just stop. Like you're not gonna get, you know, you're not gonna become a genius overnight. So just stop, go home, shower, and study. And then when it's 11, stop, go to sleep. You know, don't drag it on. Yeah.
Our next question is, did you have any self-doubt in undergrad about getting into dental school? And what advice would you give to people experiencing this?
Wow, what a good question, because I had a lot of self-doubt applying to dental school. I think that doubt, or I'm sure you guys have heard of it, imposter syndrome, is magnified in a college campus, especially being pre-health or pre-dental. You guys are surrounded by a lot of people who, you know, either have lower stats than you or super high stats. Someone's a genius or something like that. For myself, I had a lot of self-doubt applying. I wanted to take 1 year off and do post-bac. You know, I didn't think 3.521 was enough, you know, to get in. But of course, you know, it worked out. But if you're having self-doubt, you know, be realistic with yourself. You know, if you have a competitive GPA, you know, you can even message like admissions directors at schools, and, you know, just shoot your shot. Be like, hey, these are my stats. Do you have any advice? You know, be realistic with yourself. Have someone look at your essays. Have someone, you know, go over your application and just apply. You know, don't let that hinder you. But of course, if you have like a 3.0 or 2 point something, and your DAT is like a 16, you know, I mean, be realistic then. Yes, you have to retake your DAT. Yes, you have to do a post-bac. But self-doubt is normal. Tell yourself that self-doubt is normal. That's what drives you. That's what prompts us to work harder, which is fine. But also, you know, have confidence in yourself.
The next question is, how did you learn the business aspect of dentistry?
A lot of trial and error. I was, you know, I'm fortunate enough to work in a group where they kind of just let me run wild. Okay, so like I was working in I'm still working in Pasadena, Buena Park. I would sit there. Sometimes I would have no patients, 2 patients, 3 patients the whole day. When I first started, I was very depressing. Tried things out such as marketing on Yelp, uh, marketing on Google, and all that I learned by myself. Okay, like marketing on Yelp is easy. Like you just have to talk to them and they push it for you. But on Google Ads, like there's like you have to do keywords, key terms, things like that, and you can track monthly by how patients come in and you ask them where you heard me from. And I found a big uptick after I got more reviews. So it just takes time. Like if you have a new practice and you don't, you're not having like 10 patients a day at least, don't freak out. It just takes time. It's not, no one can be an overnight success. I find that even though it's cliche, people are like, take care of the patients and they'll take care of you. It's cliche, but it is true. I have patients that like today, someone came in, I did an implant on him 2 years ago, and he's been coming for cleanings, and today he brought his mom, and she needed an upper and lower new denture. They came and paid cash. He's like, you've taken good care of me, so I'm not, I got to take care of my mom. I just want you to take care of her. I'm not afraid to ask for reviews. I'm shameless. I'll be like, hey, have you had a good experience today? Please help me out. That's how people hear about us nowadays on the internet. And that way it went up. In terms of other business aspects, you just got to learn. You just got to do it. If you are a new grad or, if you're listening to this and you want to start a new business, just do it. There's no right time. Yeah.
Our next question is, what's one piece of advice you would have given to future dentists that you wish someone would have given to you?
If you're a future dentist, let's say you're in dental school trying to graduate, I'll just say the number one thing is don't be scared. Okay, don't be foolish, but don't be scared to do treatment. Document it well. I like to say under promise but over deliver. Go through informed consent with your patients about everything, but then just go for it. Don't be afraid to do that case. Don't lose sleep if you cut the tooth a little bit deeper than you might have wanted to. Dental school trains us in a way that's so negative, where they'll tell you, oh, you didn't cut this prep 0.5 millimeters or like 5 millimeters or no, like 0.8 millimeters. You did it at 1 millimeter, so you get minus points for it. Think about it, 0.2 millimeters, and you failed your test. No wonder like we get out and all the new grads are, afraid to do anything because we're so used to perfectionism. So don't be afraid to do it. If you're a college student going to dental school, don't be afraid to have fun. Have fun in dental school. It's the last time you're going to be in school. Learn a lot, make a lot of mistakes. It's your time to make mistakes. Really pick your instructor's brains and enjoy it.
Thank you, Dr. Sean. So unfortunately, that's all the time that we have today for questions. I just want to say thank you again for taking the time to be here with us and for your presentation. And with that said, everyone who tuned in today, be sure to follow Dr. Sean's Instagram. And before we end today's session, the link for the post quiz will be posted in our GroupMe. And yeah, thank you again, Dr. Sean, for being here with us.
No problem. Thank you guys. Thank you everybody. Find me on Instagram, DM me. I post cases somewhat regularly. Post my story. I'm just a regular person just like you. Don't be scared to reach out. Okay. Thank you.